Greetings and welcome to what I believe is week 9 of our program. We're almost done. Today we are going to talk about sleep and its importance in our lives. So the objectives for today regarding sleep are to list the harms of inadequate sleep for both physical and mental health, state published recommendations for sleep health, discuss sleep hygiene measures and sleep environment considerations, so things we can do to improve the way that we sleep, and list the harms of pharmacological sleep aids and talk about some things that can be more safe or taken more safely. So why does sleep matter? Sleep is essential for many, many body functions. The restoration of our hormones and our digestive system and even our brain and the way that fluids circulate throughout our bodies. It helps with our memory, processing emotions and our fears. Quite simply, we cannot survive without sleep well at all. Within a relatively short period of sleep deprivation, we start having all kinds of terrible effects. And this poor lady on the right is showing us some of these effects of sleep deprivation, of which you can see there are very many mental effects. So we think a lot about cognitive impairments, impaired judgment, difficulty with concentration, getting grouchy, things like that. Effects on relationships. We will be more grouchy, more difficult to get along with, less interested in our partners. Heart health risks, heart disease problems, and increased heart rate variability, or problems with heart rate variability. I think it's actually decreased heart rate variability, where our heart rate will not change as much as it should between rest and activity. Endocrine effects, so increased risk of diabetes, obesity, metabolism problems, and then muscle effects, decreased reaction times. This is when people often get into car accidents, whether they actually fall asleep when they're driving or if their just reaction times are so slow because they are sleep deprived and they're not able to respond to things as quickly as they should. Intoxication-like symptoms, so as if you're drunk, tremors, achiness, clumsiness, and other problems just from not getting enough sleep. So the recommendations for sleep are generally between about 7 to 9 hours per night. This does vary based on individual characteristics. Some people inherently need more than others, and as we get older, the amount of sleep we need becomes a little bit less. As you can see, a young adult, it ranges from about 6 to 11 hours of sleep. Older adults are more from 5 to 9, and more people in that lower range. And babies, as we know, are sleeping upwards of maybe 20 to 22 hours a day. And so definitely our sleep needs decline as we get older, but even older adults recommended that getting at least 7 hours of sleep a night is best for physical and mental health. So there's a couple of different ways of looking at sleep and ways that sleep can be disrupted. This one is the 3-process model of sleep, that there are sort of these 3 different components that go into how well and how much and how well people sleep. So sleep need is this biological requirement for the sleep needed. As I mentioned, there are variations within people, so some people need more than others, but within a person, it's pretty fixed. Everybody, if you've always needed 9 hours of sleep, you always will until you get older and then maybe a little bit less. But generally the amount you need is pretty constant and is around that 7 to 8 hours per night. The sleep ability is how able you are to fall asleep and to stay asleep. So this is the amount of sleep you can achieve, and can vary quite a lot. You can easily meet your sleep need with your sleep ability, or your sleep ability can fall short of your sleep need, and then you will not be getting what your biological requirements are wanting. It's influenced by stress, by illness, and by deprivation, and by different types of insomnia, which we will talk about here in more detail. And then sleep opportunity is the amount of time the person has available for sleep. And this also can vary quite a bit. Things that influence our sleep opportunity is working long hours, children waking up at night, needing our attention, working shift work, so alternating between days and nights, and having more obligations than we can fit into a reasonable day can definitely decrease our sleep opportunity. So the sleep cycle is a very complex process that many different factors influence the person's ability to sleep and awakeness versus sleep. If we start up on the upper right-hand corner with the inputs, these are some of the most influential factors affecting our alertness versus our sleep. So light, both the intensity, so how bright light is, as well as the wavelength, so at what color or what spectra the light is, has a huge effect on our sleep, which we will talk about in more detail in a couple of slides. Food has an effect on our sleep. We talk about things like tryptophan and things like that that can help with initiating sleep. Carbohydrates are also important. Having complex carbohydrates, a good meal in the morning can help with alertness and with setting the sleep cycle that way for waking up. Having also a complex carbohydrate meal in the late afternoon can help with initiating sleep a few hours later, but it's really important not to eat too close to bedtime because that can alter things and the ability to fall asleep. Ambient temperature, so the temperature in the room in which you are sleeping, has a big effect. Generally, cooler temperatures are more conducive to sleep than warmer temperatures. And fluids, so having a well-hydrated body can help to improve the ability to sleep through better blood flow and better circulation. Modifiers are pupillary reflex and sunglasses, both of which would modify the influence of the light coming into the brain. So bright light is very important for alertness, but if you have naturally very small pupils and don't absorb as much, or if you're always wearing sunglasses, you won't get as much effect from the light as somebody who does not. There is genetic variation in how much these different factors impact our ability to sleep. Our fat stores also will impact some of these things. The more fat there is, there tends to be a warmer body temperature, and so it can be more challenging to get that core body temperature cool enough to help with good quality sleep. And then vascular tone, or our blood pressure, so how easily our blood vessels dilate and constrict in order to regulate temperature as well, can influence these things. The operators are the things within our body that directly influence sleep. So the core body temperature, as I mentioned, is very important. And then two hormones, melatonin and cortisol, which we'll look at in a little bit more detail in the next slide. And cutaneous blood flow, which I alluded to, which is the circulation. And it's very important that the blood can flow nicely to the surface. Our external limbs, our legs and arms and hands and feet, tend to warm up. And as they warm up, our inner body, our core body, cools down. And in order for that to happen, there has to be good blood flow to our extremities to allow the cooling to occur. And then the outputs from all of this will be alertness and kinetic activity. So activity, movement, exercise, being awake and alert during the day, which is what we want. And then sleep at night, hopefully, and also influence our food-seeking behaviors or our hunger. So typically people will get hungry within a couple of hours of waking up, and generally are not waking up in the middle of the night feeling hungry if everything is working as it should be. And also our precision and our strength, so some of these coordination things that can be impacted positively by getting enough sleep or negatively by not getting enough sleep. And so in this slide, we talk about some of those operators, the melatonin, the cortisol, and the body temperature. So melatonin is released by the brain. All of this is managed by an area of the brain called the suprachiasmatic nucleus, which is deep in the brain. And when our brain and the body there, the SCN as it's called, begins to feel that it's time to sleep, it's going to send out pulses and our melatonin is going to rise quite substantially. The melatonin is the one in blue. And so that is the hormone that rises and tells our body it's time to go to sleep. And sort of everything settles down and we start getting sleepy and restful. The opposite thing happens with our cortisol. Cortisol is an alertness hormone, an awakening hormone, and it peaks right after we awake in the morning, so it's the black line. And so you can see it peaking right after we awake and then falls slowly, slowly throughout the entire day. And when it gets to its lowest point is right around when melatonin is spiking. And that also tells us, okay, it's time to settle down. It's time for the body to go into this rest and recharge phase. We don't need the alertness and the stimulation from the cortisol. So it will drop, and then as you see, remains fairly low through about half of the sleep period, and then begins to climb. And as it reaches its peak is when we start to wake up. And the body temperature, which is in red, also is pretty stable throughout the day, and then declines a nice dip as we enter into sleep, and then we'll slowly start to rise again towards awakening and through the morning and the day. And if these things don't happen, particularly if that body temperature is not able to fall, it makes it really hard to initiate and to maintain sleep. And here is where we talk a little bit more about light. Of all of the inputs that we mentioned before, the light and the carbohydrates and the things like that, light is by far the most significant. Melatonin secretion, as we saw, is essential for sleep initiation and maintenance, and light is the primary influence on this circadian clock in our brains. And what matters is both the intensity of the light, so how bright it is, and the spectra of the light as far as what wavelength it is, so what color light it is. And we can't really see those or perceive those spectra or those wavelengths ourselves, but they have a very significant effect on that SCN, the suprachiasmatic nucleus in our brains. So light during the day, and bright light especially during the day, is very, very important for suppressing melatonin secretion during the day and supporting alertness and awakeness during the day. And sunlight has a much, much, much greater intensity than any other type of light. Sunlight is measured, it's 100,000 lux of brightness on a bright sunny day. On a cloudy day, there's 25,000 lux, so already a quarter of what a sunny day would be. Industrial lighting is only about 1,000. In offices and kitchens is about 200 to 500 lux. Household lighting only 50 to 200. And at night, on a full moon night, there's 1 lux. On a moonless night, it's 0.001. or 2.00001 lux, so very, very little. And you can see with the sunlight being 100,000 lux, nothing else even comes close. And so that's why it's very important to try to get outside and to get bright sunlight for as much as you can during the day, particularly in the early afternoon is a great time to get out and let that sunlight into your eyes and tell your brain that it's the time to be awake, and it really helps to set a nice, good cycle for the melatonin. And then blue light is the wavelength of light that really creates a lot of problems. What blue light is what's in computers, so backlit computers, TV screens, cell phones, anything like that with a screen. Even if the screens are very, very dim and they don't seem to be putting out a lot of light, that blue light gets right back there in the brain and has these detrimental effects on our sleeping ability. It suppresses melatonin. It makes us feel more alert. It increases our heart rate, our blood pressure, our core body temperature, and our sympathetic tone. So all of these things that we really need to go down at bedtime, the blue light is preventing that from happening. So it keeps us from falling asleep, and it gives us difficulty with maintaining sleep and having a stable sleep cycle. So this is why, if there's anything you're going to do, one of the most important things to do would be to get bright light during the day and to turn those screens off, get away from the blue light within about 3 hours, 2 to 3 hours of bedtime, to prevent this blue light suppression of the normal sleep cycle. So there are many sleep disorders. Some of which are caused by us and some of which are caused by secondary health conditions. We will go over in a little bit more detail the first 3, the behaviorally induced insufficient sleep syndrome, primary insomnia, and obstructive sleep apnea. Some others are restless leg syndrome, which is this irresistible urge to move the legs, oftentimes in the evenings or at night, and that can interfere very much with sleep. Short sleep misperception is the idea that people feel as if they're not getting enough sleep, when in fact they are getting sleep, but it's not creating a restful, making them feel like they've had enough rest. Secondary insomnia can be from many things, from medications that are preventing sleep. It can be from health problems or things like that that are preventing sleep as well. Narcolepsy is kind of the opposite of insomnia. It would be the sudden irresistible urge to fall asleep at inappropriate moments. And so people will be sitting and talking and then suddenly be fast asleep. And that is a medical condition that needs specific treatment. And periodic limb movements are somewhat related to restless leg syndrome, but more are about the legs actually moving or having difficulty with being still at night. So behaviorally induced insufficient sleep syndrome is very common, and it could be best described as I don't have time to sleep. There is inadequate sleep for functional performance, so our sleep need and our sleep opportunity are not matched up. We often find that this is a voluntary restriction of sleep time. So people are giving themselves a very late bedtime or a very early wake time, irrespective of what their body is telling them they need, and is often associated with a longer sleep duration on weekends. So these are people who will sleep for 4 or 5 hours during the week and then will sleep for 10 to 12 hours during the weekend. It's associated with a younger age. We think about some maybe college students who are staying up very, very late or all night studying or cramming for tests or finishing papers or things like that. With alcohol abuse, disrupts the thoughts about the need for sleep. Long work hours, so really having limited time available to sleep. Stress can cause it, and depression can cause it as well. Another thing that can definitely contribute to this is shift work. So switching, as we mentioned, between days and nights or working nights or varying schedules can cause a lot of difficulty with finding the actual time needed for sleep. Primary insomnia could be thought of as I can't sleep whatever I do. So it's really difficulty initiating and or maintaining sleep. People who suffer from insomnia have an adequate sleep opportunity. They have the time available to sleep, but they lie in bed and they just don't sleep. Associated with sleepiness or fatigue during the day, and by definition it has to be ongoing for at least 3 months and occurring at least 3 times a week. This causes fatigue, malaise, sleepiness during the day, impaired concentration or memory, decreased motivation to do things and mood problems, errors or accidents at work and driving, and some physical symptoms, headaches, gastrointestinal problems, and also a persistent worry about sleep. You can't sleep and then get stressed out about not sleeping, and it sort of gets into this vicious cycle. And then obstructive sleep apnea people say I sleep, but I feel tired all the time. And what this is people having periods of stopping breathing during sleep. So they're either breathing too shallowly to get adequate oxygen into their bodies, or they simply stop breathing entirely. And it can last from 10 seconds to up to a minute at a time. It is quite prevalent in up to about a quarter of the population, but most people, 80%, do not know they have it. Typically, it's with people who are overweight or obese, have high blood pressure, an increased neck circumference, or metabolic syndrome. And so typically what happens with these people where the chest is too large or the neck is too large is that the tongue will fall into the back of the neck and stop the breathing process. These people often will have loud snoring. They will feel tired during the day. And sometimes a bed partner will say that they notice them stopping breathing during the night, or will suddenly make a big gasp for breath during the night and then resume breathing. And this also is a medical condition that can be treated and is important to be treated so that the quality of sleep is adequate and so that you're not putting excess strain on your body and your heart by having these periods of not breathing several times throughout the night. So what are some changes that can be done to improve sleep? And most of these are predominantly for that primary insomnia or from the behaviorally induced insufficient sleep syndrome. And things that you can do are to establish a regular sleep-wake time and routine and adhere to it even on weekends. So every day, say you're going to go to sleep at a set time and every morning wake up at a set time. And don't stray from that for more than about half an hour between wake days and weekends. And that really helps to set in your mind the sleep cycle and helps to regulate those hormones and the other things that are so important for sleep. Getting regular physical activity in the morning or early afternoon to wear out the body and get some of that alertness. Get daily exposure to outdoor light, as we talked about. Control caffeine and nicotine intake and limit alcohol. So recommends are for no caffeine in the afternoon, no alcohol within several hours of bedtime, and no nicotine at all. If possible, it's a stimulant and it can really interfere with the relaxation in the brain and the body. Powering down before bedtime, so that would be turning off the computer and TV and phone and things like that for at least 2 to 3 hours before bed. Taking a warm bath or a shower before bedtime to promote relaxation, to promote some of that vasodilation, to allow the core body temperature to actually cool down. Eat dinner at least 2 to 3 hours before bedtime. Focus on complex carbohydrates, avoid high protein and high fat foods, which can cause some more awakening and alertness. And foods with calcium or tryptophan may be helpful. And if you are feeling really tired and need to nap, sometimes that is fine, but not for more than 30 minutes at a time to prevent interfering with the established sleep cycle. Environmental changes would be keep the bedroom only for sleep and for sex. So no reading in the bedroom, no watching TV, no eating, nothing like that. And this helps to train your brain that it is only a place for sleep and makes it much easier for your brain to settle down and do that. Keep the room cool, ideally 60 to 67 degrees is what most people find the best temperature. Keep the room completely dark or use an eye mask to prevent any light from getting into your eyes and into your brain. And keep the room quiet or use earplugs or a white noise machine if there is noise that is interfering with sleep and with restfulness. Other interventions for insomnia would be cognitive behavioral therapy, which is basically working with a psychologist or a therapist on retraining the brain to have a more healthful relationship with sleep and make some changes to improve it. There's meditation or mindfulness exercises and certain relaxation exercises that can be done before bed to help quiet the body and the brain. So what about taking a sleeping pill? Can I just do that? And the answer is no, for many reasons. There are real and very substantial risks associated with sleeping pills. They can cause hangover effects, so still feeling really drowsy and having the delayed reaction time the next day. They're associated with increased falls, injury, and death, particularly among older adults. They can be addictive or habit-forming, can cause harmful sleep-related behaviors, driving, eating, or walking during the sleep, or sleep shopping. Sometimes people talk about that they go online and buy all kinds of stuff that they have no idea that they're doing. Can cause daytime memory and performance problems, and can have side effects, dizziness or lightheadedness, headaches. They can cause diarrhea and nausea. And most importantly, they don't really work as well as behavioral interventions do. They can cause some short-term benefits, but over the long term, they are not going to be as beneficial as making the behavioral changes to improve sleep hygiene and sleep environment. An integrative approach to sleep looks at using some other substances that can help with sleep that are generally considered more safe than the prescription sleeping pills. These would be things to talk to the doctor about if you're interested, but some possibilities would be valerian or ashwagandha. Chamomile is in lots of teas, chamomile tea or sleepy time tea. There's not a tremendous amount of evidence to support it, but some people swear that it helps, and sometimes even just having that quiet, calming behavior of drinking a cup of tea before bed can really help. Kava is another one, and passion flower. And so these are some different things, but as you can see, there are some risks with these as well. The kava can cause some liver damage, and the valerian can cause some withdrawal symptoms, and so these can be used, but again are not entirely without risk. Some supplements also that would be important to talk with the doctor before starting. You can take supplemental melatonin. This is most effective when you are traveling and going from one time zone to another and need to kind of reset your natural clock. You can give your body a little boost of melatonin to help to do that, get it to the right time. It can be helpful with initiating sleep as well, but often you need to do it in combination with the behavioral changes as well. Magnesium can help with restless leg syndrome and sometimes with sleep, and L-theanine also can be beneficial, but for a short period of time, not for more than 3 months. And these are some of the mind-body approaches that we mentioned before. So cognitive behavioral therapy, mindfulness-based therapy, specifically for insomnia, or mindfulness-based stress reduction, if stress is keeping you up at night. Progressive muscle relaxation, and so this is where you would lie in bed and kind of think through each muscle group from your head to your toes, and you sort of would tense everything up and then relax. So start with, your face muscles, tense everything in your face and then relax. And then tense your shoulders and relax, and tense your arms and relax, and do that slowly through your whole body. And that can sometimes really help to quiet the body down and get your mind and body ready for sleep. Meditation can help before bed or in the morning with centering the mind and calming you down for sleep. And yoga and Tai Chi sometimes can be helpful for sleep as well. So there are many things that can be tried that would certainly be safer than taking sleeping pills, and have other benefits as well, as far as our mental health and our physical health, rather than just helping with sleep. So in conclusion, sleep is essential for health and well-being. There are many reasons people struggle with sleep, but you can have a huge impact on your quality of sleep. And so the choices you make and the behaviors you undertake really do make a very, very, very large difference. So some things to think about that we will discuss in class. Why can't I sleep? What are my barriers to sleep? What are the things that keep me awake? When and where do I sleep the best, and why? And discuss how our culture has made lack of sleep a badge of honor. We'd learn about people who say, oh, I only need 4 hours of sleep. I only need 5 hours sleep. And it seems to that they're tough and that they're better than the rest of us. And so why do we think that is? There's some handouts that you can work on, and then we look forward to talking to you in class. See you soon.